Back to the terminal. Okay, let's see what that is. Don't kill the cat! Ha! Fianide is a prescription medicine used to treat various medical conditions. It is used to treat benign prostatic hyperplasia in men, which is a condition where the prostate gland becomes bigger, making it more difficult to pass urine. Fianide also helps control BPH by reverting the enlarged prostate gland to the previous state, improving the flow of urine and minimizing the need for surgery. It is also used to treat male pattern hair loss by blocking the production of a male hormone responsible for hair growth. So apparently one of the hormones that is responsible for hair growth is also responsible for hair loss. Is that what I'm supposed to gather from this? Fianide, 120 milligrams tablet, an anti-allergy medicine used to treat allergic symptoms such as runny nose. Another entry for the word. Congestion of stuffiness, sneezing, itching, swelling, and watery eyes. It may be taken with or without food, in the dose and duration as advised by the doctor. Fianide 120 milligrams tablet provides relief from symptoms such as sneezing, itching, watery eyes, and runny nose. Rarely has any serious side effects. Let's see if we're going to be able to find it in Wiki. Oh, my eyes. Reading white text on a black background makes my eyes... I get this shutter effect. I should look that up as well. Finasteride, used to treat pattern hair loss, benign prostatic hyperplasia in men, BPH. It can also be used to treat excessive hair growth in women. It is usually taken orally, but there are topical formulations for patients with hair loss designed to minimize systemic exposure by acting specifically on hair follicles. It's a 5-alpha reductase inhibitor and therefore an anti-androgen, clickety-click, testosterone blockers. It works by decreasing the production of dihydrotestosterone by about 70%. Medical uses: enlarged prostate, scalp hair loss, prostate cancer, excessive hair growth, transgender hormone therapy. Adverse effects: a 2010 Cochrane review found that for BPH found that in men with a weighted mean age of 62.4, adverse effects are rare. Nevertheless, men taking finasteride are at increased risk for impotence, erectile dysfunction, decreased libido, and ejaculation disorder versus placebo. As of 2016, fresh evidence suggested such effects along with disturbed neural steroid production may persist after finasteride is stopped. Sexual adverse effects: finasteride for androgenic alopecia, hair loss in men. For BPH, long-term may cause persistent adverse sexual, neurological, and physical effects. Oh, and there's a post-finasteride syndrome, but its validity is questioned within the medical community. Led to post-finasteride syndrome, PFS, post-sexual neurological... Yeah, what they just mentioned there. Overdose. That's worth it to look up as well. Has been studied in humans at single doses up to 400 milligrams and at continuous dosages up to 80 milligrams per day for 3 months without adverse effects observed. There is no specific recommended antidote for finasteride overdose. I don't think that any drug is supposed to be overdosed. Pharmacology, pharmacokinetics, chemistry, history. Synthetic steroid, analog of androgen steroid hormones like testosterone and DHT. As an unconjugated steroid, finasteride is highly lipophilic compound. I think that means that it likes fats. Dissolves in fats lipids. Yes. Thanks to a friend that told me what that refers to today. I think it's a bit questionable because I want to keep this show PG. Whether I should be looking up topics that are involved with sexual, even if it's just medical, because I want to cut out the taboo out of this show. I don't want to make it like a shock type of thing. I just don't want any drama. Let's just put it simply that way. But I think this was useful enough. People that have issues with the prostate area or that apparently it's used for excessive hair growth and pattern hair loss in men. But as medication, I think it's worth a look up.